Hello, and welcome to the Osteogenesis Imperfecta Foundation's podcast series. My name is Tracy Hart, and I am the Chief Executive Officer at the Osteogenesis Imperfecta Foundation, along with Petra Harvey, our Director of Program Services here at the OIF. On each podcast episode, the OI Foundation brings you information about the diagnosis and treatment of osteogenesis imperfecta, presented by an expert in the field of OI and rare bone disease. The podcasts are part of the ongoing educational effort of the Brittle Bone Disorders Consortium, part of the National Institutes of Health's Rare Diseases Clinical Research Network. We're very excited today to have someone with us today that most of you know, I'm sure, but I will introduce him anyway. Our podcast today will feature a reflection on the status of OI research and clinical care. And we're very excited to have with us Dr. J. Shapiro, endocrinologist and adjunct professor at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. Thank you, Dr. Shapiro. Did I get that right?
Thank you, Tracy, and good morning. I would also mention that we have had at the Kennedy Krieger Institute in Baltimore a bone clinic largely devoted to OI for a period of about 25 years prior to my moving for faculty work to the Uniformed Services University in Bethesda. A question is asked as to how long I have been involved in the field of OI, period. That probably dates to the early 1980s when I first encountered patients with OI, both in Worcester, Massachusetts and in Washington, D.C. The recognition of OI was prompted at that time by the desire of a number of people to develop a community commitment to OI and support of OI patients, which initially led to the first OI organization, which was rapidly supplanted by the OI Foundation, and that was probably in the late 1980s or early 1990s period. An additional question is considering my involvement with OI over a period of several years, what is my current opinion about the status of OI research in clinical care? And what I'd like to talk about first is the status of clinical care. At best, one would have to say that in most communities it is very fragmented. The reason being that most physicians have limited contact with a patient with OI and certainly would be uncertain with regard to management when involved with a patient with a more severe form of OI. That is to say that most clinicians are not familiar with the status of medical treatment, that is to say drug treatment. And the reason is that when physicians see patients with OI, they tend to equate, based on their limited experience, to somebody who has plain age-related osteoporosis. And clearly that is not the case. There is a lack of information about the efficacy of standard medical treatment ordinarily directed at improving bone status in patients with OI. Certainly, that impacts the issue of research. So that we really need a vastly enhanced application of available current research and clinical practice to researchers in the field so that they have an idea of what would be productive areas for them to pursue. Underlying all of this is the requirement for adequate funding. And for that, pressure should be constantly maintained on some of the major funding organizations, such as the NIH. Now, with regard to what are big challenges facing researchers and clinicians in OI, the initial answer to that is funding. There are many individuals active in bone research who would be happy to direct their programs towards OI if funding was available for it. The same goes for clinicians. With regard to clinicians, there should be a considerably enhanced national education program that is not intermittent, that has some element of continuity, that continually presents the issues of treatment and clinical care as regards to OI. Included in clinical care is medical support, appropriate orthopedic support, and appropriate support in physical therapy and rehabilitation. It is necessary that when individuals with OI, children or adults, sustain significant fracture, that they have available the best information and care directed towards speedy recovery. It is not helpful for a fracture that would limit activity for a non-OI patient for a couple of weeks, for the OI patient to be confronted with weeks or months of recovery. So that's one of the areas that both physical medicine and orthopedics should be asked to assist with, and for that reason, research funding should be required specifically for that purpose. The question is, what are the biggest challenges facing the community, both children and adults living with OI? And there are several levels for that. One challenge that we've already discussed is having access to adequate medical and rehabilitation care. Fractures in children and adults, or bone-related problems such as constant pain, which, for example, may interfere with sleep over a long period of time, those challenges are not well appreciated by many medical and or orthopedic physicians. For that reason, individuals with OI should be aware of and not reluctant to access centers of care that have some specialty experience, both medically, orthopedically, and in terms of rehab care with osteogenesis imperfecta. that should not limit the individual's access. That is to say, individuals should be encouraged and, if possible, given assistance to travel to centers in order to receive adequate care. Thank you, and I'd be happy to answer other questions.
Yeah, well, I just wanted to thank you, Dr. Shapiro, and highlight all of the work that you've done. You listed all the challenges that face the medical, clinical research community and the patient community, but I just want to remind people about all of the work that you're doing, even just in the last few months, to combat these challenges. Dr. Shapiro held a clinical care meeting for about 60 physicians that came from all over the country, and even international attendees came, and that was just it was so refreshing and so positive for clinicians who don't have as much experience to be able to listen to the experts on topics that relate to their clinical care. And another initiative that you started was something that's available on our website, and it's the treatment guidelines for adults. And this is for all physicians who are working with adults, for if they have questions about treatments, because there's so many options, and it's very confusing for physicians who don't have experience in clinical care or research. So I would encourage you, if you're listening to this podcast, to visit the OIF website. You can find the recommendations on the pages, especially for medical professionals, and on the page especially for adults. And you can also email bonelink@oif.org if you have any other questions. And I think
I have one for you, Dr. Shapiro.
Yes.
I neglected to mention that Dr. Shapiro has been a member of the Foundation's Medical Advisory Council for many years, and in just talking with you even before we started here today, so you've been in the field of OI 40 plus years, dealing with people with OI.
Yes?
So the issue of multidisciplinary care is something that's very important to us here and to you, obviously. And you're one of those rare physicians that is able to quarterback somebody's care from all areas. Do you think we've made progress there over the years since you started seeing patients with OI and in adults especially, and trying to coordinate their care? And what can we do? What can we do as a foundation, as a community, to keep moving that forward?
Well, thank you. Trying to coordinate care on a community basis is really one of the most important issues. I like to go back to an old advertisement for a clothing company who used to say something on the order of, "Our best customer is an informed consumer." And there's great wisdom in that. So the issue of establishing adequate care plays on two levels. One is the role of the OI Foundation, which has been dominant, and rightly so, in that effort. And again, one comes back to an informed consumer, so that individuals should stop for a moment, consult with their primary care physicians, look at the programs that are available in their community, and become familiar with them early on. The time to become familiar with them is not when someone has had an accident and is in the hospital or facing surgery. That's the wrong time. The game plan for adequate care should be established way in advance for each individual, whether they have mild or more severe OI.
Excellent, thank you. And just out of curiosity, my own curiosity, what attracted you to being part of the OI community, treating patients with OI and other rare diseases. You are an expert in not only OI but other rare skeletal diseases as well. What motivates you?
Rare diseases are rare. Their diagnosis and management is really not familiar to many physicians. So at the first level, there's a major educational need in order to advise physicians about the rare bone disorders, because although they're rare, they are frequently misdiagnosed and mismanaged. So the effort is part to inform physicians, nurses, and other in the healthcare field so that they're aware of that. The second issue is, although something is rare, that does not mean that it does not have great scientific importance in opening information to other more common disorders. So if you can figure out how to deal with the rare problems, it's going to make it easier for you to deal with the more common problems.
That's so interesting.
Yeah. Could you share with us, I can't let you go without asking you, can you share with us some of your, maybe anecdotally, a place where you were treating somebody with OI that was very special to you, something wonderful that happened, or you were able to connect the right people at the right time, even at at the Kennedy Krieger, for example.
That's an everyday experience.
I know that's an unfair question, because just with you being at the Kennedy Krieger, you established the first registry. We are still all using that first registry concept and structure as we move forward. So, I mean, for me,
Well, rather than talk about individual people,
Sure.
I think the more unusual aspect is the OI community and the manner in which individuals in the OI community tend to project and make significant their own involvement with the disorder and the impact of the disorder on their families and on their business community, and how individuals with OI are successful in that effort has always been a matter of great interest and pleasure to me, because in many instances, having a very significant disability that could limit function and family life for many people, I think there's an optimism in the OI community that tends to lessen that. So that indeed many people in the OI community are very involved and very productive.
That's awesome. I mean, that embodies what you talk about is the unbreakable spirit that the OI Foundation. It's our tagline. It's our motto. It's we have it on all of our T-shirts and calendar events and throughout our website. But I just want to say something that we hear a lot about your dedication, and I'll just say like a general anecdote. People talk about all the time how you make house calls and how you will pull over on the side of the interstate to answer calls. And I know you wouldn't say that. You wouldn't, brag or boast about yourself. But But that's like the level of commitment and dedication.
Well, I'm delighted to hear that. Delighted. Thank you.
So we thank you on
Yes, we
behalf of
do.
all of the OI community members that have been impacted and have benefited from your dedication.
Thank
still
you. Thank you all
continue.
very much.
Yes.
So thank you for joining us. I know to reach Dr. Shapiro, you can reach him through the OI Foundation. We'd be able to connect people with you.
Yep.
And again, as Petra said, visit our website at www.oif.org, and you can find out all kinds of information. And on behalf of all of us, thank you, Dr. Shapiro.
Thank you
for being here.
Thank you so
Thank you for all you do.
much.